So today I want to share my experiment, my personal experiment with high dose vitamin C for a pre-surgical and a post-surgical procedure that I had done. I had deep dove into the literature to see if high dose vitamin C can help with healing, and it does, and with pain control. So I wanted to try it out and I want to share my experience with you. So let's get into it, Faraday.
All right. So, like Dr. Durst said, she was looking at research on vitamin C. And what's really interesting is when you start looking at research on vitamin C, a lot of it goes more towards cancer patients. So, there wasn't as much on healing post surgery as I think Dr. Durst or myself would have expected.
Correct. So I guess I should give a little background even to that because we both know it, but we haven't shared, at least not in a while. So we do IV therapy at RevitalizeMD, and I was a pharmacist before I was a physician. So as I built out our IV protocol, I was super excited with everything that it could do. And so we do no kits. We just put individual ingredients together, and it took me a year to build out our protocols. So that's a little background because we can do high dose vitamin C, and it's been studied a lot in cancer patients, but it also has been studied with sepsis and ICU stays. And so it hasn't always been applied to a surgical patient specifically. And so as I was undergoing this minor surgical procedure, I wanted to look at the studies, see what dose we could do, because we do up to 75, even 100 grams if we needed to in the office. But those are more adjuncts to chemotherapy for patients that are being treated for different cancers.
And these are
And
not
so
IVs that somebody can walk in off the street and get just because they want 75 grams. There are some medical intake we have to do, some screenings, some labs to ensure it's safe. So it is not anywhere you go, high dose vitamin C is not created equal. Some may say high dose vitamin C is up to
6
6
grams.
grams.
Yeah.
So where for us, 25 is pretty easy
Yeah. 20.
to do, 20 to 25, and then as
When
high
25
as
grams is what we'll do without testing. And then anything above that in an IV, we need testing for that specifically to be done. And we still recommend testing. We just don't have to wait for it to get back if it's 25
for
grams.
safety reasons. So that's why it's really interesting before we get into all the research, because you guys wouldn't necessarily know when you go online and you're reading these and they're talking about 6 grams, 10 grams, a gram a day, where our idea of high dose and what may be in the literature is a little different.
That was a very good point, Faraday, because again, you can't always get that as part of a kit, and you wouldn't even want to trust it at certain facilities. So you definitely want to go to some place that knows IV therapy in better terms, because there's an osmolarity, there's a way to put it together and formulate it. And so not everyone should be doing high dose vitamin C, and the kits limit the amount of vitamin C that you can get. And so 6 grams a day is considered high dose. What I was looking at in 25 grams is what we'll do with our recharge, which is a very common immune support IV, just overall health, because it decreases inflammation. And that's 25 grams. So I wanted to see what the studies supported and timing of use. And so again, surgery, if you look at it as a stress on the body, no matter what, and if you have a major surgery planned, then obviously it's more stressful. And emergency surgery is even more stressful than that, because you can actually undergo that and have some malnutrition you're leading up to, or some chronic illnesses. But what happens if you are just doing a minor outpatient procedure, but maybe you're not 20 anymore and you're in your 50s and you want to see if there's something you can do to accelerate healing? Well, this is something that you could potentially do to accelerate healing, because again, it's a stress on the body. Your cortisol increases, your inflammation increases, you start to break muscle down.
Right. And what does vitamin C do? Collagen synthesis. It helps with cortisol. It helps with oxidative stress. It has all of these components. It decreases inflammation in the body. All those things that Dr. Durst mentioned happens with surgery.
Yes. Yeah. So anyhow, so what I did was look at studies prior to undergoing, and again, there were lots of things that I changed, and I will do a full video on like a prep preoperatively for a surgical procedure that you might be having, because there's things that you can do to maximize your healing after. But in particular, today we're talking about vitamin C. And the studies I could find were talking about 15 grams of vitamin C in a pre-op for decreasing inflammation, better collagen, better healing, decrease in pain intake, immune support, decreased in infections, healing postoperatively. And so all of those things were found to be beneficial, and we found multiple studies that support that.
Yeah,
And
there was
so,
a study on post-operative pain and fatigue, and that was 10 to 15 grams per day. And that was showed decreased fatigue post-surgery and decreased pain post-surgery.
mhm.
But again, just 10 to 15. Probably one of the little bit more aggressive was a study on burn patients for wound healing, and it was 1.5 grams per kilogram per day. So a little bit more aggressive, but still,
Burns are an
mm,
extensive healing process, and
exactly.
lots of collagen needed for that,
Hmm.
for sure. And then there was a total knee replacement surgery, again, a 15-gram with decrease in pain, decreased postoperative complications. And then a diabetic in a 2025 study for diabetic foot ulcers and surgery and improved healing with that.
So
And
what does that
so
mean? What did that do for you? What was your experience?
well, I wanted to say that first off, like I think all of those were great, but what I want to say even before I share my experience is, so is it safe? Is vitamin C safe? Because there were good studies and a meta-analysis that looked at 74 studies with IV high dose vitamin C. And again, high dose being greater than 6 grams. So that could vary, but it was shown to be safe. And that's the important thing. So if you go to a place reputable, and that also can alter and customize the IV for you, then you're in good hands when that happens. And the things that they looked at as potential complications is number one, kidney stones, which again doesn't have to do with vitamin C, does have to do with calcium. So if your place could take out calcium, or if they don't put it in, then that's not an issue. You can talk about hemolysis with a G6PD deficiency. We won't get into that, but that's the testing that we do
That's
when
a
we're going to
lab.
do greater than 25 grams. And you can actually have some osmolarity changes, some hypernatremia, things such as that. And then glucose. Vitamin C acts as glucose. So if somebody's having a vitamin C and might get hypoglycemic, when they go to test them, it'll show a normal blood sugar. So you actually just treat them as if they are low in blood sugar and assume that to be the case if they're sitting in front of you and they look like they're low in blood sugar. Give them something to eat. And so you can also do something through the IV. But that is the bottom line, is it's safe. There's studies to support it. And I had a fabulous outcome with it. So I did 25 grams pre-op, so the day before, and I did 25 grams within 6 hours after. And so one of my nurses came to the house and did an IV therapy here. And I have had zero in the way of pain
I
at
know
all.
that blows my mind when you
Zero.
say zero pain.
Yeah.
I mean, you're a couple days out
Yeah. Couple
and
days
like
out and was walking. Like again, couldn't
if
even
she's up and
say.
about, I sent her a text this morning. I'm like, if we need to push back the podcast, let me know. And she's like, yeah, no, I'm good. Come on.
I'm on the treadmill prepping. Come on
Yeah.
over. So I think that the issue is I didn't know what to expect. But I've had zero pain, like measurable pain. Maybe some tightness, a little bit of swelling, something like, but no pain. And again, you take pain medicine the first night thinking that maybe you would have some pain overnight. And then I took it to sleep and I never had pain prior to and not when I woke up. So no pain at all. And again, up and active and healing and feel fine,
So
feel normal.
retrospectively, would you have done anything different? Would you do vitamin C 2 days before surgery, the day before? Would you do, I know you did within 6 hours. Are you going to do another IV
So
bag?
I thought about doing a third one the day after. So like post-op and then post-op day number one, not the post-op day. And then I just chose not to because I wanted to see if the pre-op and the post-op worked. I am going to do one probably this week. But it's supposed to concentrate in the white blood cells for up to 3 weeks. And so the effects should be long lasting with that. And we're usually recommending, once a month on a standard maintenance type basis. But obviously with this, I think a once a week would not be a bad idea. And so if you can be mobile prior to the day before to do something such as a high dose vitamin C, if you have, again, a facility such as ours that can do that, and then do it immediately after. That's always a great possibility because vitamin C, as you know, is also water soluble. So you have to take lots of it for it to accumulate, and it is something that you will burn off fast with surgery. So you want something that's either sustained release with vitamin C, or you want to do, like I'll do a chewable, like the 250 milligrams, and just frequently throughout the day. But when you're doing a 25 grams, you're getting all of that IV and concentrated into the white blood cells. And again, the cancer treatments and the effects of intracellular vitamin C is amazing. Definitely for another video because it's a topic in and of itself, what it can
Yes,
do.
that can get very heavy, very deep,
Yes.
lots of science.
Yeah.
So
Yeah, it's great
that'll
stuff.
be a different podcast.
But the other things that I would do is I would look for another video because I want to be pretty comprehensive because there's lots of things you can do supplemental wise in addition to the vitamin C and just nutrition wise to prep for surgery.
I think
And
that would be
so-
great. Just
Mhm.
prep surgery, post surgery, protein, supplements, all the things. I
Yeah.
think that's awesome.
Yeah, no,
I'm
it was
excited
great.
for that one.
So far, so good. But so let me know if anyone's had experiences like that, or you want to talk about anything or little tricks that you guys have done to improve or speed up recovery, because we are willing to absolutely dive into anything wellness or sexual wellness.